doing, Mr. Miller? My name is Jack. I'll be conducting an assessment on your neurological and musculoskeletal system today.
Okay.
I'm going to start by asking some questions. Do you have any history of trauma, such as like a car accident, broken leg?
No.
No? Do you have any joint pain?
Yes.
Where at?
In my wrists?
Okay. Do you have any muscle pain?
No.
Any weakness?
No.
Any numbing or tingling at all?
No.
Okay. We're going to move on to the neurological assessment then. We're going to start by assessing cranial nerve number 3, ocular motor, cranial nerve number 4, trochanteric, and cranial nerve number 6, abducens. Okay, just look right at me. Equal size about a 3. The shape is circular. They both appear equal. I'm going to go for check reactivity now. Look at the left eye this time. Okay. Reactivity is present. I'm going to move on to accommodation. Okay, just look at this. Follow it. Keep your eyes open. Accommodation is present. We'll be on the Carnell position of gaze. Just look over there for a second. Alright, now look back at this. Alright, cranial nerve number 3, 4, and 6 appear to be intact. I'm going to move on to cranial nerve number 5, trigeminal. I'm going to do that by palpating. You open your mouth. You bite down really hard. Okay, cranial nerve number 5 appears to be intact. You can move on to cranial nerve number 7, the facial nerve. Can you smile for me? Can you puff out your cheeks? Can you raise your eyebrows? Okay, cranial nerve number 7 appears to be intact. Going to move on to cranial nerve number 11, the spinal accessory nerve. Can you shrug your shoulders for me? One more time. Okay. Cranial nerve number 11 appears to be intact. Going to move on to cranial nerve number 12, the hypoglossal nerve. Alright, can you stick your tongue out for me? Okay. Tongue appears to be midline. Cranial nerve number 12 is intact. Alright. Can move on to cerebellar function. Alright, so what I'm going to have you do is basically do this for a little bit, and then after a while just keep them right there like that. Okay? Keep them on your thighs. Go ahead and stop. Alright, I'm not seeing any abnormal movement or tremors. Alright, I'm going to begin the musculoskeletal system, starting with the shoulders. They appear to be symmetrical. Palpate for temperature. They appear to be a little warm. Do you feel any pain or tenderness when I do this?
No.
Okay. I'm now going to check for range of motion. Can you go up like this? Down like this? Okay. Go up like this. Down like this. Okay. Arms out like this. Go counterclockwise in a circle. Other way. Alright, excellent. My patient has full range of motion in the shoulders. Going to move on to the elbow. I'm not seeing any colored abnormalities or swelling. Going to palpate. Do you feel any pain or tenderness when I do this?
No.
How about now?
No.
Okay. I'm going to go for range of motion. Can you do this? And that. Arms out like this. Flip them over. One more time. Okay. Now we're going to do muscle strength. One arm like this. Okay. Try to flex. Okay. Other way. Go against me. Push this way, like you're flexing. All right. Flex. Other way. Okay. Appears the grade is about a 4. All right, can move on to the hand and wrist. Not seeing any abnormal color or swelling. Going to palpate. Any pain or tenderness when I do this?
No.
How about now?
No.
No? Okay. Now we're going to check for range of motion. All right, like this. Okay, go ahead and do this. Fingers out like this, bring them in and outward. Okay, all right, we're gonna check for grip strength, so go ahead. Grip right in. Don't pull, just squeeze. Okay, good. We'll check capillary refill. Capillary refill looks good. All right, we're going to check the radial pulse. The rhythm appears to be regular, about a force of about a 4. Now the brachial pulse. Rhythm appears to be regular, force about a 4. My patient has full range of motion, his elbows, and his hands and fingers. Okay? Now I'm going to have you lay down. Move up a little bit. A little more. A little more. Okay? Iliac crest and lower leg alignment appears to be symmetrical. I'm not seeing any knee or ankle swelling. I'm going to palpate. Any pain or tenderness?
No.
How about now?
No.
Any pain or tenderness?
No.
How about now?
No.
Any pain or tenderness?
No.
Any pain or tenderness?
No.
Okay. I'm going to check for pretibial edema. I'm not noticing any pretibial edema. I'm going to check capillary refill. Capillary refill looks good. Now we're going to get the dorsalis pedis pulse. appears to be regular. Body force about a 4. Now the post-tibial pulse. Rhythm appears to be regular. Body force about a 4. Okay, now we're going to assess for range of motion. You lift your leg up like this, one at a time. Other leg. Alright, now one leg at a time, bring them out like this. And keep it a little lower, make it easier. Alright, appears my patient has full range of movement in the supine position. Alright, you sit up for me. Alright, we're going to check for hip strength. Alright, try to move your leg up like this against resistance. Go ahead. Okay, other one. Okay. Appears to be a grade about 5. Now we're going to move on to the knee. Try to kick your leg out like that. Okay, one more time. Okay, go ahead. Go ahead. Alright, muscle strength appears to be about a 5. Alright, now we're going to move on down to the feet. Alright. Next one I'm going to have you do is kick your foot out like this. Other one. Excellent. I'm going to have you do your foot like this. One at a time. Other foot. Okay, now we're going to check for ankle muscle strength. Alright, put your foot out a little bit. Okay, try and push that way. Good. Bring it back. Excellent. Go again. Bring it back. Alright. Ankle appears to be about a 5 muscle strength. My patient has full range of motion in the ankle. Alright, I'm going to have you step up now. Now going to move on to the spine. Actually, might need you to take this off real quick. Appears to be symmetrical on both sides. The contour is concave. Next I'm going to palpate. Any pain or tenderness when I do this?
No.
How about now?
No.
How about now?
No.
Okay. Next we're going to move on to range of motion. So I'm going to have you go down, touch your toes. Good. Next I'm going to have you rotate like this. Okay. Next I'm going to do lateral bending. One like this, one like that. Okay. Next I'm going to have you walk all the way over there and come back. The gait appears to be normal. I'm not noticing any abnormal movements. Alright, you can go ahead and take a seat, put your shirt back on. Alright, that'll conclude our assessment today. Thank you for your time, Mr. Miller.
Thank you.
Thank you.